Hello, everyone. Good evening from Akoko Africa Radio UK, and this is Health Talk with Atswei. Our timing is quite different today. We have a special edition today with Geraldine, and she is coming to talk today about ADHD. Most of you already know Geraldine. She's been with us before. And she's come back. She's not just a pharmacist. She got masters in the pharmacy, so she knows her work. Before we start the show, let's get a message from our sponsors, and then we'll come right back and just dive in it. Okay?
When it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, You Smile is the best. For your indoor programs, for executive programs, for corporate events, You Smile is the place to be. Call on us, and we shall give you the best of services. Our telephone numbers are 0242571571 and also 0243639381. Our social media handles are IG You Smile Events, on Facebook You Smile Events, and also on TikTok You Smile Events. Come and let's do business, and you'll never regret it. You Smile. Satisfaction is our hallmark. We'll make sure we deliver, and our delivery is always on point.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because
when it comes to balloons and balloons decoration for your baby Christian, for your ceiling floral, You Smile is the place to be. For your wedding setup, your beautiful wedding setup, backdrops, and everything when it comes to planning, coordinating, and delivery, You Smile is the best. For your indoor programs, for executive programs, for corporate events, You Smile is a place to be. Call on us, and we shall give you the best of services. Our telephone numbers are 0242571571 and also 0243639381. Our social media handles are IG You Smile Events, on Facebook You Smile Events, and also on TikTok You Smile Events. Come and let's do business, and you'll never regret it. You Smile. Satisfaction is our hallmark. We'll make sure we deliver, and our delivery is always on point.
Hello, we are back, and the time is 5:34. We won't take much of your time today. I don't know if you heard about ADHD before. I don't know much about it, so I'm really here today to learn so much. I will introduce Geraldine. Geraldine,
Hello.
you are welcome
Hi.
to Akoko. You've been here before. Most of our listeners know you. For the sake of those who are seeing you for the very first time, if you can introduce yourself.
Okay. Glad to be here. My name's Geraldine. I have a degree in a Masters of Pharmacy and been a pharmacist for 6 years now. So, yeah, I'm glad to be here again. I'm talking about a topic that's somewhat new to me in the last year or so, but I've been doing a lot of focus on it, which is ADHD. So I'm looking forward to talking about it with you.
Okay. Thank you very much. So, please stay with us. We are live on the radio, on YouTube, and on Facebook. And we'll come back to check if you have any questions for Geraldine. Please send all your questions and we'll be sure to answer them for you. Okay? All right. So, Geraldine, ADHD.
Yes.
What kind of animal is that? It sounds strange. What is that? Can you
Yeah.
tell us what it's all about?
So ADHD is an acronym, medical acronym, meaning it stands for Attention Deficit Hyperactivity Disorder.
Okay.
And this is a common illness. It's an illness most commonly diagnosed in children. But now, with more awareness, they are starting to diagnose some adults with it. But it normally starts in childhood, early detection. Basically, in a nutshell, it's a illness that describes people who have trouble paying attention, sitting still, and controlling their impulses.
Okay.
Yeah. There's three subcategories of ADHD. So there's people who have difficulties paying attention, and then the hyperactivity. So this is called the ADHD combined type. And then there's people who have difficulty with attention and organization. And that's called the ADHD inattentive type, or also known as just attention deficit without the
Okay.
hyperactivity. And then there's people who are just hyper and impulsive. And that's the ADHD hyperactivity subtype. ADHD basically affects certain parts of the brain, and that results in people having the inability to solve problems, to plan ahead, to understand others' actions, and control their impulses. So in children and adults, it basically results in them struggling to, they're easily distracted,
Okay.
and they have trouble finishing tasks. Like I was saying, it is common in childhood. It is commonly detected in childhood. Normally under the age of 12 is when you start seeing the signs
Okay.
of someone who may have ADHD. And it basically creates impairment in at least two areas of the child's life. So not only just at school, but you'll see it in the home life, in other environments, around family members. And there's no cure for it per se, but it's a very interesting disease. The more you learn about it.
Okay. All right. So, what is hyperfocus?
Okay, so hyperfocus is basically something used to describe, because when you hear attention deficit, you think this person struggles to pay attention whatsoever, but it's not that they can't pay attention at all. People with ADHD can actually pay attention. It's just that they have difficulty in controlling and directing and sustaining their attention. So if you were to give them certain tasks, you would see the attention appear. But if you give them a task they're uninterested in, or maybe they just have difficulty grasping, that's when they just can't give it that attention. So it's not the complete inability to have any sort of attention. It's just in some areas. And people with ADHD can pay a lot of attention to things that interest them or excite them, or things they find immediately rewarding, you know.
Okay.
So you can find people with ADHD that are very successful, you know, in business and things like that, or children that are good at sports, but still suffer from ADHD. So when it comes to playing football, they're a star. When it comes to doing their mathematics, you know, they just can't pay attention for more than 5 minutes. So that ability to pay attention to something that interests them or they find rewarding, that's where you see the hyper focus. So it means they have got that extreme focus when it comes to that one task, but in everything else, that's where the attention lacks.
All right.
Yeah.
This is quite interesting because looking at it, it looks like in Africa, these things are not diagnosed and people just live their lives with it. You be in the class with someone and they are not doing well and they are ashamed.
Yes.
But for all you know, they are suffering from something like this and it's not diagnosed.
Yes, yeah. And there's this common understanding of like, it's like trying to judge how a fish climbs a tree, you know? If you put it in the ocean, you would see it do wondrous things and what it's designed for and things that you see that attention, that ability to succeed. But you ask it to climb a tree, there's probably no interest. It will just struggle. And, you know, like you're saying, back home, so many children are, you know, beaten or they're just labeled a bad child. But it could just actually genuinely be parts of the brain that are just struggling when it comes to certain tasks. But you put them in another task and you may see them succeed. So it's good to have that awareness.
Wow. Thank you very much. So would you say that is only affected, it can affect only children?
No. So in the UK, obviously there's an underdiagnosis in Africa, but I don't know the whole of Europe, but in the UK alone, there's 10 million adults who have been diagnosed with ADHD. About 1/3 of children with ADHD continue to meet the criteria into their teenage years and into adulthood as well. And in early adulthood, so your teenage years, ADHD may be associated with depression, mood, or conduct disorders and substance abuse. So, you know, when we're thinking our teenagers are just being moody, going through the hormones, yes, some of them that is the case. Some of them that is a kind of opportunity to see if they could potentially be sufferers of ADHD. Adults with ADHD often cope with difficulties at work, in their personal and family lives, and this is where you can start to see some of the symptoms. But because they weren't diagnosed in childhood, they've just kind of got on with it, maybe succeeded in one area that's allowed them to get a career or get a degree, but it doesn't mean that they're not suffering in other areas of their life. So yeah.
I see. Interesting. All right. So how is it diagnosed?
ADHD. So there's no single test. It's basically a comprehensive evaluation to establish a diagnosis and rule out other causes and determine the presence or absence of coexisting conditions. It's basically an evaluation that requires a lot of time and effort and includes a careful history taking and a clinical assessment of the individual's academic, social and emotional functioning and developmental level. So in essence, you go to a specialist. So not all doctors, not all consultants understand ADHD. It's a very, very specialized area. So they design these questionnaires, which over time they've kind of grouped people they've formally diagnosed, and they've looked at the questions that needed to be answered. And so these are the kind of questionnaires they apply, as well as diving into the person's life and looking at, like I said, the academic, social and developmental levels.
Okay.
I've got a questionnaire later, so maybe
you can diagnose me.
Oh, by God's grace, you know, you won't be diagnosed.
Okay. So most people confuse ADHD with autism. Is there a difference?
Yes. So autism is a bit more, how can I put it? It's more to do with the social interaction, behavioral interaction. Attention deficit it can tie into it, but it's more specialized in your ability to pay attention, complete tasks, just that subtype. Autism is a very big spectrum.
Okay.
And it ranges from people, I don't know if you know, it's divided into high functioning and low functioning autism. And so people that are extremely intelligent, extremely successful can be autistic. And then there's the extreme end, people that are unable to have a conversation, people that are unable to hold a job, attend normal school, regular school, shall I say. So yeah, there's links, but they are two separate conditions.
Separate conditions. Okay. Thank you so much. So what are some symptoms of ADHD?
So some symptoms include, like I said, trouble paying attention, inattention to detail and making careless mistakes. And when I say all of this, you may think, oh, I do that. We all do that. But with these people, it's you can see it's very often, you know, to the point where sometimes you think they're just not listening. And even they get frustrated with themselves because they are trying and they're not retaining, or they're really, really fighting hard to concentrate or pay attention. Easily distracted, very easily distracted, losing things such as in children's school supplies. You know, you imagine like each day your child's coming home with one shoe. Forgetting to turn in homework, trouble finishing classwork and homework, trouble listening, trouble following adults' instructions, fidgeting, inability to stay seated, running or climbing excessively, always on the go, impulsive, talk too much, blurt out answers, you know, simple instruction, put your hand up first. They'll forget in less than 2 seconds that you told them to do that. And just impatience. Those are the early signs in children that you would see.
Oh, okay.
Yeah.
I think in the UK here at schools, the children are taught about things like that. Because I remember my daughter came home one day and he said, Mommy, I think I have ADHD because I tend to forget. You know, they try to analyze themselves and see where they fall.
Yes.
But I don't think we do that in back home in Africa.
No, not at all.
And this is something that needs to be looked into, because if a child has this, and like you're saying, let's say he's very good in football, but it's not good in mathematics. So you know, most parents want their children to be a doctor,
engineer,
yes,
lawyer.
a lawyer, and all those things. But maybe they have this condition and they can do their football very well. I mean,
or they could be an interior designer,
Yes.
you know, and the best at it.
Yes. So if we all understand this, you rather focus on what they are very good at, and then you push them
And nurture it.
Yes.
And yes.
Yeah.
Yeah. Especially in today's world where there's so many different ways to be successful. You know, even more successful than the doctors and the engineers. And
I
all
know,
of that.
right?
Yeah. And so you can establish a business. So if we can just understand that and not be quick to label children or even adults as bad people or rebels or whichever, you know, it's good to bring that awareness.
Okay. Thank you. You are still listening to Atswei Africa Radio UK, and this is Health Talk with Atswei. We still have the beautiful Geraldine here, and we are talking about ADHD. The time now is 5:48. We'll be finishing soon, don't worry. Please stay with us. Okay, Geraldine, so ADHD, is it a brain-based condition?
Yes, so it's completely neurological, i.e. it's to do with the brain. And it's basically they can do images of the brain, and people with ADHD have actual structural differences with people who have not got it. So meaning there's a physical difference when you get an image of the brain of someone that has it and someone that doesn't. You actually see differences. So for people that say, oh, it's all in the mind, you're choosing not to pay attention. No, they've actually seen, if they compare the images of the two, you'll see structural differences. and it can run in families. So there's a genetic element
Oh,
sometimes.
okay.
Children whose parents have ADHD, up to a 60% chance. Sorry, children whose parents have it or had it, there's up to a 60% chance the children could have it as well, which is a high probability.
Wow.
Yeah, that's what they've found. Yeah.
Oh, okay. So what are the types of treatment for ADHD?
So, like we were saying, the process is to get a thorough evaluation by specialists. Don't just go to a general practitioner. They haven't got the skills to, no offense, they haven't got the skills to, because it's fairly new and it's a growing understanding of the condition. So they haven't got all the skills or tools to diagnose. So you go to a specialist, someone that's been studying this for a significant amount of time, and they do the evaluation. And the right treatment, really, majority of the time, is medication. It's not the only treatment, though. I will talk about others, but because I'm a pharmacist, I'm more aware of the medication. And so when I talk about the medication, they're split into subcategories. These medications can help the person control his or her symptoms on the day that the pills are taken.
Okay.
Yeah, so it is something that you need to take daily, because the medication you can't take one pill and you feel okay for a few days. No.
It's not like you having a headache and then you take this thing and then it goes away.
No, yeah, like, or how can I liken it? Like, if I took blood pressure pills consecutively for 7 days, but I forget 3 days after that, my blood pressure is not going to be too out of control. Whereas with ADHD medication, if I forget to take it tomorrow, you could see a completely different level of concentration between the 2 days. So it's really short-acting medication. So you have, the medications are well established and very effective. They've been studied for a long time. So one group of medications called stimulants, and that's your methylphenidate and your amphetamine. You and I would know they're controlled drugs. They're controlled drugs, and actually, chemically, they're very structurally similar to cocaine.
Oh, interesting.
Yeah, so cocaine is it's a stimulant as well. And how they work is by changing the levels of dopamine in the brain. Dopamine's the chemical that's responsible for attention and concentration in our brain. So they basically increase the levels of dopamine in the brain to help you pay attention. And they also help the brain nerves, also known as your neurons, communicate more effectively. So kind of piecing information together, they help with that process. They boost your energy and they make you feel more alert. So like I was mentioning to you, you have to take it on the day that you need it. And you have your short-acting ones, which are you would need to take 2 to 3 times a day. And then you have your long-acting ones, which last about 8 to 12 hours. Those are normally easier to take because you just take the one and it can last for the whole day.
Oh, okay.
Your long-acting. So it's really dependent. With children, you tend to see them more on the long-acting ones. They just have to take something in the morning. Whereas with the adults is where you see the short-acting one, because they may just need it for a certain purpose. Oh, just whilst I'm at work, or when there's a certain period of the day where things are a bit more intense. Let me just take this pill. It lasts 2 to 3 hours, and then it works that way.
Oh, okay.
Yeah.
All right.
Then you have your non-stimulants, which is your they increase a chemical called noradrenaline, and that plays a role in executive function, memory, and alertness. Non-stimulants are said to be a bit better in the sense that they cause less dependency. They're not controlled drugs. But the only thing is you have to take these for almost weeks to months to start to see the effects.
The effects, okay.
Yeah, whereas the other one's more immediate. The minute you take it, the brain just starts focusing. So yeah, nowadays you'll notice a lot of adults on the medication for it as well. That's why there was a huge shortage in the UK, because adults were benefiting from it. They were getting their work done, their assignments. They were finding they were more effective at work, even home life. They were able to do more of the things around the house, not forgetting things as easily. You know, if you're looking after kids and you're forgetful or you're struggling with paying attention, you could miss important
Meetings and stuff. Yeah.
So a lot of adults are benefiting now from being diagnosed. They've noticed that difference in their parenting, in their home life, in their work life. So yeah. And the other options are kind of therapy and a therapist kind of teaching you skills to try and pay attention, but that's not as effective as the medication. Yeah.
Oh, okay. So how well does the medication work?
So when your medication's working effectively, you will have sustained focus. So, you know, earlier we were talking about hyperfocus. Sustained focus is different. Hyperfocus comes naturally and it's kind of very specific to one task. Sustained focus means you can sit that child in a classroom, teach them English, history, mathematics, and they'll be able to sustain that focus. Hyperfocus is the child is just there waiting for PE so you can play football, you know. So when you've achieved that sustained focus, you know your medication's working well for you. So for some people it's trial and error. They need to try different medications, they need to try different dosing regimens, and then find that kind of formulation and treatment that works well for them. Other signs that it's working well, it can improve the mood, less extreme emotions, and less impulsivity. You notice that the child isn't just blurting out answers, or the adult isn't getting those impulses. They can now be a bit more relaxed, a bit more controlled.
Oh, okay. Well, that's interesting. You know, sometimes you hear people say that this type of things is not an African thing. It's just things for these white people or whatever they say. But what would you say? Does it affect more blacks or does it affect more white people?
Funny enough, I actually recently met a consultant who was African. He's a cardiologist and young man, but he works in the States. And he was saying that he takes these stimulants and he used it all throughout his exams. So he used it all throughout his exams in university. He uses it sometimes on days of work, you know, when he's just had a tough week, but he needs to get through the week. And he says he doesn't even know if he would be a consultant to this day, get through that much schooling without the help of the medication. And he's African. I won't say where from, you know.
Yeah.
I won't be too specific.
Yeah,
but
of course.
He said it genuinely helped him, and he's living like a very successful career and life. So that kind of gave me an inkling into, wow, there's non-whites that use this thing and they say it works for them. It's not addictive because he only takes it when he needs it. And again, it just burns out the body. Yeah.
So instead of living your life going through difficulties like that, there's help.
Yeah, if you need the assistance.
Yeah. So if you find any of these symptoms in yourself or in your child, you need to consult your GP or your health whatever advisor, and you can help your child or even yourself to live a normal life. You don't have to struggle through life like that. Thank you so much, Geraldine.
It's true.
Thank you. So what are the side effects? Obviously, most medication has got side effects.
Yeah.
Are there any side effects to the medication?
Yeah, so in some of these medications, unfortunately, especially with the children, because children are growing and this medication works through the brain, it can cause things like decreased appetite, insomnia, irritability, stomach ache, and headache. Those are the common side effects, and some of these resolve if you just make sure you take it after food. But the more serious side effects are weight loss, slowing of growth in height, and tics. You know tics? Yeah. So here in the UK, we do annual reviews. Well, the general practice does 1 year review, and then their consultant does another review. So they have 2 reviews a year, every 6 months it should be. Because with the children, we want to make sure they're still growing at a healthy rate. We want to make sure the medication isn't interfering with their weight, ability to put on weight, and they're not developing those tics. If that does happen, then it's a simple case of changing the medication, and then some of these things resolve. Also, treatment breaks. You know, if they're not in school in the summer holiday, don't treat them. Let them play. They don't have to be on this medication if they're not studying. So we give them that advice. We closely monitor the child. We take their weight, their blood pressure, their height, make sure they're still developing at a normal rate. So even though these side effects are there, not everyone suffers from them. A. B, if you're closely monitoring, you can change the medication. There's so many different options. Yeah.
Oh, okay. All right, thank you. So what other condition can occur with ADHD?
So more than 2/3 of individuals with ADHD have at least one other coexisting condition. Any disorder can exist with ADHD, but certain disorders tend to be more common with sufferers of ADHD. I'll just go through the list.
Okay.
So 40% of individuals with ADHD have oppositional defiant disorder, ODD.
ODD.
I actually spoke about this with you at work, and we both learned what it meant. It involves a pattern of arguing, losing your temper, refusing to follow rules, blaming others, deliberately annoying others, being angry, resentful, spiteful, and vindictive. So you might just think the child's being defiant, but they've got the official diagnosis of this, which is ODD. There's also conduct disorder. So 27% of children, or 20 to 25% of adults with ADHD may be aggressive towards people or animals, and destroy property, lie or steal things from others, run away, skip school, break rules. And in adults, they often exhibit behaviors where they get in trouble with the law or trouble at work. They're just defiant. So these conditions tend to appear in 40% of people that suffer from ADHD. So, you know, if you're seeing this pattern as an adult or within a child, it could be linked. It could be signs that this ADHD. And I've after reviewing parents whose children are on the medication, you know, some of these issues resolved. The aggression, you know, because it's hard as a parent of a child with this condition. You just can't understand, why is this child so aggressive, or why are they... This medication helps not only the child but the parent manage a bit more, because these conditions are linked. And so with the treatment, they can see that improvement. 38% of adults have a co-occurring mood disorder. So it's the extreme changes in mood, you know, just almost on the verge of bipolar. And in children, you may see they're just in a bad mood often. They cry daily or frequently irritable with others for no apparent reason. And mood disorders can include depression and, like I said, bipolar disorder. 14% of children with ADHD also have depression. And the depression is kind of linked to the disease, the condition itself.
Okay.
They're depressed, they can't concentrate. They're depressed, they may be not excelling in school, and their teachers are constantly looking at them like, what's wrong with you? Your parents are looking at you like, what's wrong with you? Your classmates may be looking at you like, why can't you just sit still? Why can't you concentrate? So again, people that are suffering from this are genuinely suffering. And if you just take the time to study what's actually going on here, you'll begin to realize that some of these things are out of their control. And if there is treatment for it, it's worth exploring. And yeah, those are just some of the conditions that are closely linked to ADHD.
Okay, how about OCD?
No.
It's
no.
All right.
I didn't find a statistic that it's a co-disorder.
Okay. So there's this thing about stigma. And I think because of that, most parents don't want their child diagnosed because of what other people are going to say, or what would you say about that?
So what I've noticed is it's funny, here in the West, they love screaming out their diagnosis because they almost want to like make everyone aware, this is what I have, so in case it appears, then I'm sorry, but this is a
At least
formal
you
diagnosis.
understand them when they are doing something.
But back home, it's true. You don't want to label, especially prematurely. Like the child hasn't been assessed. The parents, like, you know, if we start going down this road of assessment, then it's almost like we've put the condition on the child. Like it wouldn't have been there if we didn't talk about it. But I don't understand why treatment and diagnosis can't be confidential. Do you understand what I mean?
Yes.
If, you know, the child is taking their medication in the morning and you don't even really need to discuss that, oh, this child has this child has this. The treatment is just there as and when needed. It's effective. The child takes the pill, they go to school and they perform better. I think that would be better than everyone suffers. I see it as, if you keep ignoring it, the child is suffering, the symptoms are emerging, they're not excelling, they're not succeeding, or they're not as successful as they could be. Everyone is getting frustrated with the situation. But okay, your image has been saved. I don't know, you're suffering behind closed doors. I don't see why you wouldn't want to make things easier for yourself, or at least explore better way of coping. And that to me would be, let's just see. The doctor could turn around and say, no, the child doesn't have ADHD. Give it 2 years. Your child just has a lot of energy at the moment. In 2 years, let's see again. Maybe they'll be fine. Or the doctor could say, do you know what? They're showing signs. Try this medication. Just like some of you are taking a pill for blood pressure or cholesterol in the morning. You give your child that as and when needed during school time. Summer, they don't even have to touch the stuff. On holiday, they don't even have to be medicated. And you could see a huge difference.
I mean, if you leave the child without this help and thinking about your what do you call
Image.
it? Your image,
Reputation.
yes, that's not helping the child.
No.
And this child might be suffering, especially I can imagine when you are in school and then you are not performing well in class. It's so difficult.
It could lead to bullying.
Yeah.
Isolation. Yeah.
Because I remember growing up, going to school, well, I was doing well in class, and then I found myself in the uni. And because that was not what I wanted to do, I was doing science, and my dad said, no, you have to do accounting. So I'm pushed into doing accounting by force. And I was really struggling. And because of that, I found every morning going to class very, very difficult, very, very frightening. I don't want to. So now when everyone is sleeping, I'm trying to overwork myself to be able to learn, because when I go to class, I try to sit at the back so that the teacher would not call me. And then this lecturer noticed that I'm always sitting at the back.
Yeah.
So he will call me.
On purpose.
On purpose. And then at a point, he asked me to sit in front. And that was so difficult for me. And this is me not suffering ADHD, but it's just that something that I'm not interested in.
Yes.
You understand?
Yes.
So I ended up forcing myself to learn to pass that class because I wanted to leave his class and go to the next level.
Yeah.
So I can imagine if somebody is genuinely having this problem.
Yeah, because you gain that desire to pass the class, and your brain literally was able to say, concentrate enough to pass this thing and get out. What if someone's saying concentrate, and no matter how much they tell themselves, no matter what they do, the brain literally is not allowing them to
You
achieve
still can't
that.
concentrate.
Yes.
You know, it's so difficult for a child going through something like that. So I'm thinking we shouldn't be thinking about our image or what other people are going to say about us, but just focus on ourselves and what is good and best for ourselves and our children.
Yeah.
And it will be okay for all of us if we do that.
Yeah. Yes, this is true.
All right. Okay, Geraldine. So What else have you got to tell us? Because this is my last question for you.
Oh, okay. No, it was just to do the screening. So I managed to find a screening tool online. It's just a short abbreviation of the kind of questionnaire you would get if they were assessing you. So just to talk about some of the questions you would be asked, and just to get people thinking, if you've got any family members or children where you noticed, oh, this might apply. If you want to explore it further, you can.
All right. So before we go into that, everyone get ready because we are all going to be assessed today. Let's take a message from our sponsors, and then we come back. We're having a lot of technical issues today, but well, the show is still going on.
Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your natural beauty and shine from within. Discover the magic of Tiny Hands Locks today. Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step of the way. And when it comes to products, we've curated a range of natural wonders that are sure to leave your hair feeling pampered and rejuvenated. From clarifying shampoos to revitalizing conditioners, each product is meticulously formulated with nature's finest ingredients to cleanse, nourish, and protect your locks. But wait, there's more. Visit our website at www.tinyhandslocks.co.uk to explore our full range of services and products. Located at 24 Swan Close, Feltham, TW13 6PA. Just give us a call at 0783 298 9531 and we'll take care of the rest. So what are you waiting for? Treat yourself to the luxury and care you deserve with Tiny Hands Locks. Because at Tiny Hands Locks, we're not just about hair, we're about empowering you to embrace your natural beauty and shine from within. Discover the magic of Tiny Hands Locks today. Hey there, fabulous folks. Are you ready to take your locks to new heights of beauty and vitality? Then listen up, because Tiny Hands Locks is here to make your hair dreams a reality. Located at the heart of natural beauty, Tiny Hands Locks isn't just a salon, it's a sanctuary where your locks are pampered and celebrated. Now, let's talk about our top-notch hair care services and products. At Tiny Hands Locks, we believe in the power of nature's bounty to nurture and revitalize your locks. At Tiny Hands Locks, we are dedicated to crafting bespoke lock styles that enhance your natural beauty and reflect your unique personality. From starter locks to locks maintenance, we've got you covered every step.
Hello, everyone. We are back. Are you ready for Geraldine? So we are going to get assess every one of us here today. Let's see who has it. Okay. Over to you, Geraldine.
Okay. So this is from the website ADHD UK, and it asks you questions, and it needs you to answer from never to very often. Yeah. So I'll give you the options. How often do you have trouble wrapping up the final details of a project once the challenging parts have been done? So imagine you're presenting or you've got a project, you've been asked to complete a task. Those last details, so you've done the hard part, the actual bulk of the work, but tying everything up, summarizing or even completing it, you know, the temptation to, if it's due in 2 days, instead of just finishing it there and then, you may think, oh, I've got time, and you just think,
No, I like to finish it there and then.
Okay. So you don't have trouble tying everything
No.
together. Okay. So never or rarely?
Never.
Never. Okay. How often do you have difficulty getting things in order when you have to do a task that requires organization? So your options are never, rarely, sometimes, often, very often.
Sometimes.
Sometimes. How often do you have problems remembering appointments or obligations? Never, rarely, sometimes, often, very often.
Never.
When you have a task that requires a lot of thought, how often do you avoid or delay getting started?
Sometimes.
Sometimes. Okay, how often do you fidget or squirm with your hands or feet when you have to sit down for a long time?
No, never.
Never. How often do you feel overly active and compelled to do things like you were driven by a motor?
Never.
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 You know, as I'm asking this, sometimes I can think of some people and I'm like,
I know.
I think you need a visit.
I
'cause-
can think of someone as well.
Okay, it's taking me to the next section of the questionnaire. Okay. So, how often do you make careless mistakes when you have to work on a boring or difficult project? So something you just have no interest in, but you've been asked to do it. How often are you making careless mistakes?
Sometimes.
Sometimes. How often do you have difficulty keeping your attention when you are doing boring or repetitive work? So do you find yourself getting up to do something else? Do you find yourself...
Something boring, isn't it?
Yeah,
Yeah, sometimes.
sometimes. How often do you have difficulty concentrating on what people say to you, even when they are speaking to you directly?
Never.
Never. How often do you misplace or have difficulty finding things at home or at work? Are you constantly losing things?
No.
No.
Never.
How often are you distracted by activity or noise around you?
Sometimes.
Sometimes.
Yeah.
See, that's funny. I actually, when it comes to studying, I can't study in silence.
Oh.
I love background noise. It's almost like too much silence is distracting. So when I hear people say it has to be quiet, you know, if they hear a plane go by or whatever, that immediately their attention's gone.
Yeah.
But for me, no, I can still focus in chaos. How often do you leave your seat in meetings or other situations in which you're expected to remain seated?
No, I don't.
Never.
Yeah.
How often do you feel restless or fidgety? Never.
Unless I'm not well.
Oh, okay. How often do you have difficulty unwinding and relaxing when you have time to yourself? That's a good question. Some people actually can't relax.
Sometimes.
Sometimes.
Yeah.
Okay. How often do you find yourself taking too much? Sorry, how often do you find yourself talking too much when you are in social situations? Oh gosh, never.
No.
I can answer that one for you. When you're in a conversation, how often do you find yourself finishing the sentences of the people you are talking to before they can finish them themselves?
No, I try not to do that.
Okay. How often do you have difficulty waiting your turn in situations when turn taking is required?
Yeah, I always wait.
Always.
Yeah.
How often do you interrupt others when they are busy?
I try not to.
Rarely or never?
Yeah, rarely.
Rarely. So let's see what the results are.
What am I now? OCD?
Okay. Okay. So in section A, the first half of the questions, a score of 4 or more indicates that the patient has symptoms highly consistent with ADHD. In section B, they weren't used directly in diagnosis, but are used to help inform the conversation with your the person who's assessing you. So let me just see. So yeah, a score of 4 or more would indicate that you've got symptoms that are highly consistent. You scored 1.
Oh.
And section B, you scored 0. So yeah, you're very far off having ADHD. We thank God.
We need to check DJ Kobe as well.
True. No, we have to do that off air.
Okay. Thank you so much. I hope you guys enjoyed this. Let's see if we have any questions online.
Do you know anyone that suffers from ADHD, by the way?
Actually, thinking and learning about it now, I have a few people I need to diagnose. Let's see if we have some questions here. You know, because we don't talk about stuff like that, and people think we live with things that we are not supposed to live with, things that we can get help with. We live with them because we are not even aware that it's a problem. Be like, oh, as for me, I'm like this. Yeah.
But the problem is, it should be a choice. And explore the options, because I know people that will sit in extreme pain. They just are so against taking painkillers, and that's fine.
Yeah.
But that's your choice to sit in pain. But if someone is struggling, genuinely struggling to get on with work or school, and there's this option to relieve them from their symptoms, you give them that choice.
Yes.
And then when they're older, or whichever, you know, they can decide, I want to continue, I want to stop. But it's the blocking the complete idea without even exploring it that's unfair, I think. Yeah,
it is. Okay, so I don't really have any questions here today. I guess you are that good that
I've explained everything.
you have explained everything and they don't need any questions. So is there anything else you like as your final word before we conclude today's show?
Just that I hope I brought some awareness to the condition. I hope that even you know what we discussed today is just a slight introduction to the condition, and just having the conversation, exploring the options is worth doing. You don't necessarily have to go on medication. You don't necessarily have to accept the diagnosis, but just having the conversation, I believe, is important, especially if you notice some of the symptoms we're talking about today. And remember, the child is in your care. You've got to make those decisions for them, I understand, but having a conversation won't hurt anyone. So if there's a specialist or any kind of resources you can look into, I would highly suggest it. And I look forward to the next show.
Okay. Let me ask this question. So, is it possible that somebody may have it, but they don't necessarily take medication? Maybe some other things to help them?
Yeah, so there's degrees to it, and like I was saying, that therapy. There's therapists that specialize in people who have ADHD, and they teach them techniques. So you know how I was telling you there's structural changes to the brain. I believe some people have extreme changes, and some people might have slight. So those people that have slight, maybe the more behavioral techniques that they're taught in therapy would work. Whereas other people, if their structure is completely different, most likely they may need the medication to achieve the kind of results they would want.
Okay.
And so you may be slightly attention deficient. Yeah. Slightly attention deficient, and you may not need medication, but you may be, by identifying it and speaking to someone, you may be talked to about things that can improve
To help
your symptoms, without meds.
All right. Thank you so much, Geraldine.
That's fine.
Thank you. Okay, so I have a question here. How to learn about the disorder and how it affects your life?
How to learn about the disorder. So in the UK here, we have a referral system. So it could just be as simple as, I've noticed my child's not completing their homework, or I've noticed they're very impulsive. No matter what I do, no matter what I try, they're not listening. So in the UK here, you mention that to a GP, they refer you on to a specialist to have that conversation. I believe back home it would be a lot more difficult, because I don't know how many people, how many clinicians specialize in this area. But I believe online there are many resources like this tool that I've used. It was just a website, and there's so many more websites that I came across where you could just ask a few questions, and then I know there's clinicians that offer remote consultations. So you pay them wherever you are, and they could set up a online call and talk to you further about the condition. But I would start with online resources, definitely. Yeah. What was the other half of the question?
And how it affects your life?
How it affects your life. Yeah, the ability to get tasks done, even holding relationships, how you conduct yourself with partners, family members, siblings, friends, sufferers, it can affect them in that area. Imagine having a partner who's got undiagnosed and you think they're just ignoring you on purpose, or there's a lack of love, you don't pay attention. But imagine someone suffering and they don't even know. So people that have been formally diagnosed, and there's that awareness, the people around them become more patient. Also employers, if you give them that formal diagnosis, they can understand, okay, fine, let's find an area you excel in, let's put you there, because I see that you struggle here, and it's not just because you don't want to do it, you may genuinely be suffering.
Okay.
So
All right, thank you. The other question is this brain disorder?
Yes. Like I mentioned, there is said to be that genetic element. So if you as an adult have it, or you were diagnosed as a child, there's a 60% chance your child may have the diagnosis. So there's that genetic link they've found, but also the brain imaging that they do. So scanning the brain, getting an image and seeing those differences between someone who has it and someone who doesn't.
Oh, okay.
Yeah, so there's structural differences. So it's all neurological, it's all in the brain.
All right. Okay. Thank you so much, Geraldine. Is there another question? Let me see. Is it good to accept the disorder?
Is it good to accept it? um, Again, it's a disorder, just like any. Is it good to accept high blood pressure? Is it good to accept high cholesterol, diabetes? No one wants to be unwell. No one wants to be far from quote unquote normal. Everyone wants to be optimal health and have everything working well, working efficiently. But identifying that struggle would be better than ignoring it and suffering in silence, or even not living life to the maximum, or not reaching your full potential.
Yeah.
Because imagine if you're only struggling to concentrate, not grasp the idea, not a measure of your intelligence, just your ability to concentrate enough to take in information. If medication can help you do that, if identifying the diagnosis can make you do that, then why not go down that road?
Of course.
Yeah.
I mean, to accept it, yes, sometimes you need to accept. If you don't accept it, you won't be able to get help for it. Yeah. So you accept and then you work on it. Yeah. Thank you.
And it doesn't always result in medication. That's what people need to understand. Yeah.
Thank you so much. We are still listening to Akoko Africa Radio UK. This is Health Talk with Atswei, and it's 6:30 UK time. We have come to the end of the show, and I hope you've learned something. I've learned a lot today as well, and I hope you will take something out of it. If you have a child or even yourself and you see some of these symptoms, you can talk to your GP. You don't have to suffer alone. You don't have to endure all those things, especially with the children. I worry about the children, so that they can get the help that they need and they can excel in their various careers, whatever they want to do. With those help, I think everybody can decide to be like, I want to be this or I want to be that, and they can go on and be good at it. So please and please forget about stigma, forget about your image, and help yourself or help your child. It's really, really important. I want to take this opportunity to thank you so much, Geraldine, for taking your time. Today has been a very challenging day for all of us, but we finally come to the end of the show. Thank you for your patience, and we hope to see you back here soon.
Yes, thank you. Thank you all for having me.
Our listeners really love you. So please don't stay long and come back again. All right. So from all of us at Akok, we say thank you and goodbye for now.
Bye.
Was off. Mine was off.